Hi, I'm Dr. Lisa Simpson, President and CEO of AcademyHealth. Welcome to our Future of HSR interview series. As AcademyHealth celebrates 40 years advancing health services research and health policy, I wanted to build on that history to look forward at how our field is changing and how we might align our work towards higher impact, more equitable research in the future. In this series, I'll be talking with leaders in health services research, in health policy, and innovation to reflect on where we've been and, more importantly, where we're going next. Today, I'm talking to somebody you should know about and you're going to learn much more about. And that is Dr. Clif Gaus, the CEO of the National Association of ACOs and actually the co-founder of the Association for Health Services Research, which merged with the Alpha Center 22 years ago to become what we have today as AcademyHealth. And I'm really thrilled about this particular conversation because Clif and I go way back. He actually gave me my first job in Washington, D.C. And he has really got a vantage point, not just on AcademyHealth and its role, but the historical arc of health services research, where it's been and where it needs to go. So we're going to dive right in and learn a little bit more about that arc of our field and, importantly, our organization. So Clif, thanks again for joining us. When you were first thinking about the need for an association for our field of health services research, why did you think that? What was in your mind as you started working on that?
Thank you, Lisa, for this opportunity here to sort of spill my brains on a long ago history. I think that the founding and the idea to do it would date us back to beyond long before actually it was founded, and had to do with my graduate work at Hopkins, my mentor Carl White, and just infused in me this important need to drive policy with data and facts and research. And there was very little at that time research into how healthcare was delivered and financed. And so there was lots of research, but not health services research. And so as my career evolved, I ended up in Social Security Administration, where there was a small research arm, and mentored by Dorothy Rice, who was just an advocate for data and how it was so important to the policy process. And then I had a hand in creating HCFA, the Healthcare Financing Administration, and was fortunate enough to move all of the research staff that worked for me in Social Security to HCFA. And then spent a good part of 4 years doing all kinds of very applied health services research, actually including funding some centers out of the HCFA finance, research financing. And we even had a journal of healthcare finance that we created. So having been tired out of the fast pace of government policy and just a need for change, I jumped to Georgetown University, and I guess in the early days trying to figure out what the heck I was going to do with my life at that point. But what kept coming back to me was that we had not yet, even though there was a National Center for Health Services Research, there was to be created, an Agency for Healthcare Policy Research, now ARC. There still just was not this voice for health services research anywhere. And I just kind of said, well, it's time for the field to realize that we have to be a player in not just healthcare policy, but in fighting for our own monies to do the work we do. And that's what kind of created the idea to form, at that time, the Association for Health Service Research, now AcademyHealth, and the rest is written history.
That critical importance of having a voice for the field, you really recognize that, from your days in federal government and just the Washington environment. And obviously that need continues today and is part of what Academy Health's charge continues to be, is to advocate for the field. So as you think back over the last 40 years of Academy Health's history, but intertwined with your history, and you've worked in, like I said, so many different vantage points, whether it was HCFA or you were the director of the Agency for Healthcare, ACPR, Agency for Healthcare Policy and Research. It's hard to even remember what it was before it became AHRQ, and so many other roles. As you think about that, what happened that you expected, and that was the whole plan, the plan all along, and what happened that you didn't expect, in terms of both Academy Health, but also the field, and obviously that shaped what Academy Health had to do in response.
I think what I had hoped to happen and happened was this almost a land rush of new young investigators embarking on a career in health service research. And in my early graduate school days, there probably weren't 50 health service researchers in the whole country. Carr White was, coined the term. My mentor, Carr White, coined the term health service research. There was a small group at North Carolina and Hopkins, and it was just it was just a nascent field. To look at the now and the thousands, maybe 10,000, investigators in this field is what I hoped would happen, and obviously it did. I think what I wasn't prepared for was, as we tried to focus our certain parts of health service research on policy, that we would become part of a political game, a political fight.
Excellent point about the role of politics. And, I think you and I have talked a number of times about the need for health services research to impact, to actually inform decision-making and drive better decisions. Well, the more successful we are as a field and at Academy Health in helping to support that, the more likely those decisions are going to, as they say in Washington, gore somebody's ox. It's somebody, will see that as contrary to their personal or financial interests. And then now you layer on that the issues of misinformation and disinformation. And I think it just elevates the challenges for our field, but also I think in a way it's kind of, it shows how relevant the research is, because it is informing choices. It is helping not just policymakers, but health system leaders and consumers make better choices for their healthcare for themselves and their community. Where do you think the field is today? Is it relevant to the work you're doing at NACOs? Is it relevant to health systems? Does it continue to be relevant to policymakers? Would you give it a grade? Where do you think we can do better?
I give it it's a mixed bag. There's a lot of research, and I don't mean to demean it. But it's research that sometimes I'll read about and try to interpret into a policy vein, and can't. On the other hand, what I think we've missed over the years is a strong enough commitment to what I'll call basic research, basic science research. And there is a lot that goes on, I think, in the graduate schools, and there is this need, I think, as economics and statistics and kind of the public health have fields have evolved and developed. I mean, we're part of that evolution as well. So I think the science has gotten better. Certainly the analytic methods and the data have gotten much better from when we started. And that is impacting, I think, the direction of healthcare. However, I have to say that there are a lot of other more powerful driving forces that's changing healthcare than health service research. And these are big money investments from private equity, new ways of delivering healthcare that are part of these private equity plays. We see also the kinds of impacts that COVID has brought to the country and to care delivery. And I don't think we were ready for that. Our public health infrastructure, as you would agree, is very underfunded and undeveloped. But I think I've been heartened by a lot of the work that health service research is doing on the impacts of COVID. And it's not the clinical impacts, but the healthcare system impacts. So the field has stepped up in a big way there. And the second area that I guess I'm kind of really proud of is that there's a whole lot of more research going on around equity and what it means to be underserved. How do we measure it? And that's very important to my job now. At ACOs, administration is moving in a lot of different directions to improve equity and access, and we're part of that. And we're relying on some of the work that comes out of the universities in health service research.
We're really seeing much more commitment to not just that part of health services research, which is sort of documenting and understanding why we have inequity and disparities, but really now tackling the hard part of, how do we change it? How do we craft policies that actually promote equity? And like you said, the administration is really focused on that. And I think the field has a big role to play in helping not just help create, inform those policies, but then evaluate their impact, because, we all know about unintended consequences of, the best policies.
Also, pay homage to the foundations for their support of health service research. And it goes back to the very beginning, the story of when I founded the organization. We didn't have money to incorporate. We didn't have any money to do anything with. And the Robert Wood Johnson Foundation and my good friend Bob Landon, provided this initial $25,000 seed money to start it. And RWJ, was such a big player for so many years, still is. But now there are many other foundations who are deeply invested in work in health service research. And that's been a very important element. That and NIH, to complement the ARC money, has been a fabulous sort of expansion of our field.
Yeah, it's a great point about the public sector funding and its diversification. I would also mention the Veterans Administration through their health services research and development. They've been critical in funding, really relevant research to improve VA care, and the foundations have been essential, as you said. So, given this landscape that you've described and where we've been, and you talked about the growth in our field since, those 15 people when you were in graduate school. What advice do you have for people, who to recruit them into our field and to thrive?
Well, I wish we could go back to the days when I was a student and supported solely by a public health service scholarship, paid for all my tuition, living costs. I mean, I couldn't have gone to graduate school without it. Still worked part-time to get through, but we don't have that kind of funding anymore. And so it is a challenge, I'm sure, for the universities and for students to enter our field. My message to them would be, from my perspective, I couldn't have had a more pleasing and I guess gratifying run at this, and that there'll always be a need for research and data in this country, whether it's to influence the federal government or the Congress, or more importantly, maybe just influence the way physicians and hospitals are structured and deliver their health care and how we measure quality. So if you want to make a contribution to healthcare, become a researcher and do the work that drives change.
So I think that's a great place to end this conversation, which I hate to end, but thank you so much, Clif, for joining us.